Hello, my name is Chisomo Piri, and today's my 16th birthday. I've been very lucky to make it up to this point in my life because many children die before the age of 5 of things such as malaria, pneumonia, diarrhea, meningitis, and malnutrition. I myself have had malaria multiple times because the nets are reserved for my grandparents and for my 3-year-old sister. We're 10 people in my little hut I like to call home, including my grandparents, my 6 siblings, my mother, and I. Since I was a little girl, I've been expected to help everyone because I'm the eldest daughter. I've been taught how to be a good future wife since I was young, and I was even sent to an initiation camp at the age of 10 after I got my first period. There, we were taught how to cook, clean, and how to keep our husbands happy.
What does a woman usually do?
Okay. Cook, sweep, washing the clothes, and washing clothes.
Okay.
Shortly after this initiation, I was taught that I have to have unprotected sex with a man as soon as possible, preferably an older man, because if not, I would not be considered a woman. And if I didn't do this, I wouldn't be considered a woman in my village's eyes. I didn't want to do it, but I had to, or else I wouldn't be considered eligible for marriage. So today, after having all of this done, I had my future husband propose to me, and he is 30 years old. This is not uncommon because 1 in 2 girls in Malawi are married before their 18th birthday, and 1 in 8 are married before their 15th birthday. This puts us at risk for so many different things, including HIV, STIs, and especially HPV, which causes cervical cancer, which is the 8th leading cause of death in Malawi right now. It also causes us to not be able to finish a proper education, and it puts us at risk for domestic violence especially. My uncle gladly accepted my proposal, one of the reasons being because my family is in dire need of the dowry. Soon I'll be having to move in with my husband, and we both don't really have a job. We're both farmers. I still work in the fields, just like 67% of girls who never went to high school. Since we don't have a steady income, I'm very worried about what happens if I get pregnant. I don't really know how one can become pregnant. I don't know how these issues, like how gynecological things work. But and it's very hard for us to get birth control because I live in a really isolated area. I know that sometimes community-based agents do come to give us condoms, but the thing is they often judge us, and because of it, we're not willing to go see them for help. Whenever we do go to them, they usually only tend to give about 5 condoms a person because they're expensive. I don't have the money to buy them myself because of how expensive they are, and they often don't even have them at stock in most stores. Either way, I don't think it's right for me to buy them because only promiscuous women or prostitutes buy those. Even if I did buy it, I don't know if my husband would use them because a lot of men think, and even a lot of women, that the condoms are too porous to work, that they secretly contain the HIV virus, or that it'll even cause sores on the man's penis. Therefore, I really don't know if my husband would even use them. Since there's other options out there, I don't even know how they work, but also I've heard things about how they can cause damage to the woman in the future. A friend of mine went onto the Depo-Provera injection for 6 months, and now she still can't have babies. I also heard that a woman was beaten by her husband because he heard that she was on the injection or on the pill, and that he thought that the medication would make him go sterile. I really don't know what I should do. I'm thinking that maybe I should save up some money so that I can go see the local Bajala Matsugolo which is the family planting center in Malawi, And in the end, maybe I'll do it, but if I do, it would definitely have to be behind my husband's back in case this makes him angry.
I am now 17 years old, 6 months pregnant with my first child. Entering motherhood is probably one of the most awaited, happiest, and life-changing events of a woman's life. I am indeed one of them who are impatiently waiting to see and hold my firstborn in my arms. However, in my country, Malawi, where poverty is endemic and there's abundant scars of medical resources and assistance, as a future mother, there is no single day that I do not agonize for the health of my both baby and I, especially when being aware and witnessing with my own eyes the reality of pregnant women like me in Malawi. My country has one of the highest maternal mortality rate in the world, which accounts for 1 in 36 expectant mother die due to hemorrhage, sepsis, hypertension of pregnancy, and complication of a safe abortion. It is really frightening and frustrating at the same time because a simple access to skilled attendant, antenatal and postnatal care, sufficient teaching, prevention, screening, and treatment to prevent those unnecessary maternal death are really offered and not easily accessible to everyone. It mostly received an insufficient funding that resulted for most of the time to lack of medical supplies like medications, staff, and etc. to accommodate all the millions of pregnant women in my country. Even though these services are actually offered for free, many pregnant women, including myself, is unable to take advantage and benefit to those offers due to various reasons. I, myself, belong to 1 in 5 of women living in the rural areas who doesn't know about these services exist in my community. Lack of education also plays a role in order for women like me to neglect seeking medical help. I did not finish my high school. Like most of women in my country, as a result, we do not know the importance and significance of teaching, screening, and treatment given to expectant mother like me that we must have. Therefore, I do not seek professional help. At the first trimester of my pregnancy, a healthcare worker finally visited our isolated village and explained to me the importance of going and completing 4 antenatal checkups to promote safe pregnancy, especially for the teenage pregnancy like me, who is the most at risk of suffering from maternal complication and death. He referred me to the nearest antenatal clinic, which is 3 hours away from where I live. I was eager to go, as I know that this will be beneficial for not only for my baby, but also for my own health. However, the cost of transportation is very expensive and unaffordable, especially for those women like me who are already struggling on a daily basis to put food on the table and sustain a proper nutrition for my pregnancy. Also, one of the factors that I need to consider is asking permission to my husband, which is imperative to my culture. He, like others, is mostly against it. Due to lack of education and awareness of possible complications for us not having a proper education about maternity health, my husband mostly perceived that me going to the hospital is just a waste of money, energy, and time. I, myself, most of the time think the same way. I have so much responsibilities and chores at home and as a wife on a daily basis, and me missing one day is unacceptable. I am now on my 6 months of pregnancy. Like most of the women in my village, I am letting a traditional birth attendant in my village deliver my firstborn at my house. Despite of my excruciating distress that our decision is very risky, dangerous, and illegal, due to the fact that, like many mothers who had been through and suffered to this way of giving birth, infection, hemorrhage, and other life-threatening complications during and after birth are predominant on this kind of practice, which most of the time it results for losing the life of unborn child and mother. This unfortunate situation happens for the reason that She does not have a proper training, sterile equipment, medication and life support measures, and abilities in case something life-threatening situation would have happened. I, like most of the mothers in my village, have no choice but to trust, pray, and hope that everything will be fine. I belong to 85% of women of childbearing age who live in a rural setting where it takes us 3 to 4 hours by bus to reach the nearest hospital, which by then, like many other women who have tried, end up losing their child and their own life along the way. I am scared, but my reality does not leave me many choices, and this is the reality of pregnant women like me in my country, Malawi.
I am now 21 years old. I am currently pregnant for the 4th time with my 3rd child. My 3rd pregnancy ended abruptly. Every year, at least 30 million women will become pregnant and be exposed to the malaria parasite. I was one of them. The symptoms and complications of malaria during pregnancy all depend on my body's immunity and the intensity of the transmission. Even though I've had malaria a couple of times, as a child, I was susceptible once again during my pregnancy. Not only is my body constantly changing while I'm pregnant, but I'm also carrying a life unexposed to the world. Since I live in a country where the incidence of malaria is high, and I've been exposed to a parasite multiple times before, the clinical symptoms might not always be present. I did not have a fever at first, so by the time my other symptoms came, the malaria parasite had been in my body longer than anticipated. This allows more time for the parasite to reach the placenta. Even though I had lost a baby, I still consider myself lucky. Having a malarial infection during pregnancy causes approximately 10,000 maternal deaths each year, and I survived. Now that I am pregnant again, my husband and I are afraid. He has given me consent to seek antenatal care. I am so thankful for his blessing that I don't even mind the 3-hour-long trips to the hospital. Fortunately, antenatal care is free in the district hospital. I was even given an insecticide-treated net to protect me during the night. I learned that malaria can cause infant deaths postpartum as well, having a high risk for premature and low birth weight babies. Having a net in my home makes me feel safer. The antenatal clinic has taught me that children under the age of 5 are also at a greater risk for malarial infection. There are many other households in my village who do not have nets or not enough to protect the entire family. My neighbor has a household of 7 people, and only the grandfather and the granddaughter sleep under the net. The rest are completely exposed to infectious mosquitoes. Thankfully, the season when malaria is at its peak is over. January to April is the rainy season in Malawi, but that doesn't mean that malaria is not around. It is worrisome, as malaria is a prevalent disease in my country. Yes, there are treatments available for when you get sick, but the cost and distance often pose as a barrier to getting help. Fortunately, there is a program that helps in increasing safer pregnancies and reducing maternal and newborn deaths. Many women in Africa lack access to medical care or effective tools such as nets. PSI, a local organization that works with UNICEF, plans to distribute 2 million nets to villages in remote areas so that all pregnant women and their children can sleep safely under a net. Development is a step-by-step process. I'm glad to see that things are looking up here in Malawi.
I am now 28 years old. I currently have 5 children. My husband is working in the fields, and I am too. A few days ago, my husband has been complaining about feeling weak and tired all the time. Because of his fatigue, he is unable to work. We've decided to go to the hospital to see what was wrong with him. We left our kids with my cousin. We made sure we brought our medical passports and a bit of kwacha. We took the minibus ride to the hospital near Star Village. The ride there lasted an hour and a half, and it cost us each 2,500 kwacha, which is equivalent to $3.65. For the majority of my people, this is a large amount of money, considering that we are earning only less than $1 a day. Once arrived at the hospital, we came into the emergency ward. In this room, many other individuals like us were waiting patiently for their turn to be checked. Men, women, babies, kids, all were waiting. Some were sitting on chairs, others were standing, and others lay on the floor. We waited about 2 hours before being seen by a doctor. My husband and I were brought into a room, and we were questioned a lot. The doctor asked my husband, "How long have you been feeling this way? Do you have a history of cardiac or respiratory disease? Are you taking any medications? When was the last time you came to the hospital?" After answering all these questions, the doctor admitted my husband to the male medical ward so he could receive care. My husband has been in the hospital for over 2 weeks now. Every passing day, his condition doesn't seem to be improving. He has developed a cough and has been having difficulty breathing. As I look at him, I see how he struggles for every breath he takes in. He becomes so tired from breathing that he is unable to sit up on his own. I don't know if he's going to be better. I love my husband, but by the way he looks now, I can tell his end is approaching. I remain as strong as I can, but deep down, I'm in absolute fear. What will I do without him? My husband is gone. I still don't understand how he deteriorated so quickly. The doctor came to speak to me, and to my shock, he strongly suggested that I go for HIV testing and counseling. Why should I go? Was my husband positive? I mean, how can he possibly be? It is true that at times I was unable to satisfy him completely, but even though he sought pleasure elsewhere, he always came back to me. Honestly, I am scared. I begin to have many doubts. Could I have HIV? Could my children have HIV? Is it my fault? I didn't want to go get tested. I refuse to believe that I could be sick when I am feeling completely fine. I don't want to be part of the 1 million Malawians currently living with HIV. Being HIV positive is difficult, especially in my country where this disease is stigmatized. I decided to go for the sake of my family. I went to get tested alone. I discovered I was positive.
How many times have you been to the hospital?
I've been to the hospital every 3 months.
Every 3 months. And can you tell me for what reason?
Positive.
I have decided to keep my status a secret. I refuse to disclose my status, as others may not only disown me, they may perceive me as dead. Also, I don't want to be a burden to my children. I don't want them having the reputation of being the kids of an HIV-positive mother. Their life at school and in the village would be difficult. I know that HIV is a terrible disease and that it kills. In terms of how it can be spread, I know that other people think that mosquitoes can carry the virus. For my case, I am certain that my husband isn't responsible for bringing HIV into our household. What I do believe is that I have contracted HIV as a result of my neighbor's curse. I don't know what I did to anger them, but there's nothing I can do about it anymore. I am part of the 12.9% of Malawian women who have HIV. I have accepted my positive status. I don't know how long I will have, but in the meantime, I will be on antiretroviral treatment to help decrease my viral load in order to avoid deterioration of my illness. Taking medications every day is overwhelming. Returning to the hospital at the ART clinic, the antiretroviral treatment clinic, every 3 months to get a refill on my prescription is burdensome. It is tiresome, but I know I've got to do it in order to live longer.
I am now 35 years old. Losing my husband was heartbreaking to my family and I. During that time, I also lost my mother to HIV. Since I am the only girl in my family, I will play the role of caretaker for my father. I now live with him, my 5 children, and my 2 grandchildren. Since I am the sole provider of my household, putting food on the table every day will be my biggest challenge. Will I be able to feed my family today? Will my children live until their next birthday? Will I fall sick like my husband and leave my family burdened? These are the questions that keep me up at night. I know I must be strong. I cannot dwell on the future when I have no knowledge of it. As I start my day, I pray that God will give me strength and have a plan for my future. I get up as early as 4 a.m. to tend to the fields and clean my house. It's always better early in the morning when the sun isn't beating down and the moon can provide me with a bit of light. This will take a huge part of my morning. I work in the fields and hope that my crops will provide my family with enough food for the year. Once that is done, I will cook lunch for my family. For this, I will need to cut some wood. Using my late mother's axe, I split the remaining wood for today's cooking fire. I have to be very careful because any slip of the hand can get me severely injured. I can cut myself mistakenly with a sharp blade since the conditions are unsafe. Wood chopping can also account for the main cause of eye injury in my country due to the flying debris and the misplacement of the axe. When this happens and treatment is delayed, even minor injuries can result in permanent blindness. My sister has been in an identical situation. She initially used traditional medicine from a Sananga, but she found no success in his herbal treatments. After 1 week, she decided to go to the hospital since her condition was only getting worse. It was very difficult since the closest healthcare facility was a 3-hour walk away. With no money to pay for a minibus, we had to walk. Once she arrived, the damage was irreversible and she was permanently blind. I think of her every day and try my best to avoid such injuries. Once the fire is started, I will prepare sima. This dish is made from maize flour and water. The flour is poured into boiling water, which will make a porridge, and then paddled to create a thick paste. You must pull the thick paste against the side of the hot pot and quickly whip it as it continues to sit over the heat. Since this is the staple food of my country, most of my family's meals will be sima. If we are lucky, we can afford beans to accompany it. My hands over time have become callous due to the numerous burns. Since I have to manipulate the flour as it is still boiling, it has made my fingers rough and scarred from the boiling hot water. Many women get burned from scalding and the flame itself. About 70.6% of burn victims at Kamuzu Central Hospital were treated for cooking injuries over fire. Infections after a burn is common with 31%, and most burns need debridement, skin grafting, and 11% of the time amputation. This entitles me to be very vigilant and careful while cooking, and making sure my child is securely wrapped on my back so she doesn't fall into the fire, as children often do. One thing I cannot avoid is the effects of the burning wood and what it does to my lungs. I sit around the fire for multiple hours a day, breathing in that heavy toxic gas. I don't have fire starters, so burning plastic is very common. Biomass fuel for cooking are significantly associated with bronchitis, pneumonia, and an increased chance of developing chronic obstructive pulmonary disorder. Multiple clinicians in Malawi report that severe heart failure in late middle-aged women with lung disease is a common presentation and is most likely related to the use of biomass fuels. This health hazard is mostly linked with the cultural belief that women should be the ones cooking and preparing food. In my opinion, the use of this fuel is an under-recognized threat to women like me. At this point, there is nothing I can do. I must feed my family, and the only way I can afford to do so is to put my own health at risk. Malnutrition is also a danger that many women worry about in my village. The expectation of a woman is to feed her husband first, and in my case my father, since he is the man of the house, then to feed my children and my grandchildren. I will be the last to get served, and if there isn't enough food, I won't be eating on that day. The Ministry of Health's micronutrient survey revealed that 57% of non-pregnant women had subclinical vitamin A deficiency due to inadequate intake. Vitamin A deficiency lowers immunity, interferes with growth and development, and reduces my chances of surviving a serious illness. All these factors make it hard for me to keep my strengths up on a daily basis. I push through, but I'm not sure how much longer I can take. I would consider myself as being a strong woman, but I cannot say that I am a healthy woman. I am HIV positive, and I have moments where I feel extremely weak and tired. Since I am the woman, I must continue on with my daily routine and take care of my family's needs. Some days, the side effects of ART are so extreme, the neuropathy makes even walking or standing in the fields absolutely unbearable. Regardless of the pain and suffering, I have to take my role as the mother seriously and make sure I can give my family as much as I possibly can. Mpavu, as we would say in Chichewa, strong. I am a woman and I am strong.
I am now 40 years old. I have been living with HIV for 12 years. Since my husband died, I have struggled to meet my family's day-to-day needs. We survive now on only what I can grow. Each year, I provide less and less food for my family because I feel weak and tired all the time. I have recently stopped taking my antiretroviral medication. It has become such a burden for me to transport myself to the hospital and wait for hours. 2 months ago, my leg was swollen. I started having pain in the lower part of my leg, but I kept on with my daily routine. I endured the pain because I had greater responsibilities to attend to. As time went by, my foot became twice its size, and I had big lumps on my ankle. I was frustrated because I could barely get out of bed and take care of my children, grandchildren, and my father. I felt obligated to travel to the nearest hospital to find a cure to my unknown condition. I used a wooden stick to stabilize myself on my feet as I hopped on 3 packed buses to get to the highest care facility. When I got to Kamuzu Central Hospital, the doctors told me I have Kaposi sarcoma, which is a type of skin cancer, usually associated with HIV. I was sitting on the dirty floor of the hospital waiting for hours to be seen by a physician. When my turn came, I was brought into a small room and was given basic information of my prognosis. The doctor was explaining to me details of my disease, but it was very difficult for me to understand the words he was using. I felt confused and lost. They soon after transferred me to palliative care counseling for oncology patients. The nurse informed me that Kaposi sarcoma is curable, with weekly doses of vincristine for about a month. Since I lived far away from the hospital, I got admitted to the female medical ward on the same day. I was anxious about staying in the hospital because I didn't know who would take care of my grandchildren, father, and children. My eldest daughter had to leave the village to come take care of me as a guardian while I was in the hospital. A guardian is expected to bathe, feed, and provide any kind of support to the patient. In Malawian hospitals, Nurses cannot cope with additional tasks because they are expected to take care of 70 to 80 patients on their own. I asked myself, how do they do it? How would I cope? During my treatment, I felt even more weak than before. I developed anemia because of my chemotherapy medication. I was also given Tylenol to help with my pain because I still felt the burning sensations in my lower limb. I was fighting as hard as I can, but I felt like my body was giving up. After 2 weeks of treatment, a nurse announced me that I was not responding to the chemotherapy medication and that there was nothing they could do for me. I was in shock. I have been praying every day since my husband died. I prayed God to help me through my daily struggles, and help has not come. I have always given my best in everything for my children, for my husband, and for my family. Why would God do this to me? Am I cursed? Did I do something wrong? What did I do to live this life of suffering? At that moment in my life, I felt powerless. My illness took over my body. Still today, I fear death, because if I die tomorrow, I have nothing to give to my children and my grandchildren. I wish I could talk to someone about my fears. In my culture, talking about death is not a common thing. People believe that if you talk about death, it brings death. For now, I recognize that my time has come. I don't fear for myself, but I worry for the survival of my family once I am gone.
The emotion is real because this person is real to all of us. Although each girl took a turn, and this is a fictitious person, we saw this over and over and over again. So to all of us, and to anyone who has been with us in previous years, this is a real story of the struggle of women in Malawi, and hence the emotion. I want to also mention something else, because I know Doug Miller is here, and it is Doug Miller's village.
So
it's his wife, Nellie Saka's village. And I don't want you to think that all villages necessarily perpetuate the myths and so on that we've been talking about, but there are many, many rural villages that still believe in witchcraft, that perpetuate these myths, and so everything that the girls have talked about today is indeed true. Makupo village, where we stay, where Vanier's been involved with since 2008, has made huge inroads to destigmatize and to get people talking about HIV. The woman who actually admitted on camera, knowing that all of you would see this, who said, yes, I'm positive. And that's what we've tried to do in our little village through the visits over the years, through education, is to get people talking about HIV, destigmatizing it so that people will go get tested and will receive treatment. And so Makupo, where we've all stayed, is not a typical village anymore because of education. So I needed to mention that because for Doug Miller's sake, who's worked so very, very hard to get people in the village to talk openly, and I wanted him to know that this is not representative of Makupo, but as I say, many, many other rural villages, and certainly the patients that we see in the hospital. Another round of applause, because I'm blown away by this girl. This is the village that we call home for the first 3.5 weeks of our time in Malawi. The people are warm, they're caring, and in fact the girls this year said, we want to go back once we were in the city. And I said, well, that's not in our budget. We can't afford that. And they all opened up their purses and said, here's the money, we want to go back. So we actually went back for just one day. We traveled from the city back to Makupo village for one more traditional meal and an opportunity to see everyone and hug everyone and just feel that we were back in the cocoon, which is now Makupo village. And so I think I can end there, and I think what we have in store for you will speak for itself. Thank you.
Can you tell me, what does Malawi mean to you?
Malawi it's like a very homey, family-oriented, friendly place. Everyone is just so nice, and you don't know people and they'll say hi to you as if you were their brothers or their sisters. We were in the village and it was like I was a daughter to all the Amai. So it's nice, it's warm, it's the warm heart.
Everyone is nice, and it's really like, it's worth coming back here if ever I have a chance. I'll have a chance.
Malawi means to me a place of discovery. I got to discover a beautiful country, a beautiful culture, and had the chance to live with 5 amazing girls. And I got to know Melanie and just embracing a new culture. So I think it was a place of discovery for me.
Right now, Malawi means it's a part of my self-growth right now. Malawi has shown me a lot of things that I can't describe in this short interview.
Malawi is the place where I gained experience not only as a nurse, but as an individual as well. I feel a lot more confident, more outgoing in everything that I do. And so Malawi is a place that I'll never forget.
It made me focus on like how the little things back at home that we tend to stress about really aren't important. And how like, I'm never gonna take for granted the little things either ever again. But it also kind of taught me that things aren't always like fair, basically. Like it's, you think about people up here and you see how they live and everyone's so happy and you'd expect them to be so sad. And you think, wow, these people really got cheated in life, but at the same time, they're really happy and they accept the way their life is. So it just really, Malawi helped me look at things from a different perspective, really, and it helped me grow, I think, a lot. Some of it I feel, some of it I don't.
If you had a message for future applicants, what would it be?
Just do it. don't think about it. Just do it, and even though it's hard, it's really hard work, and you won't always feel like always good, sekula bimba, but it's worth it, and just do it because it'll change your life, and you'll see things so differently, and I think that it'll make you a better person and definitely a better nurse.
Don't be shy to get out of your shell, experience, have good conversations with other Malawian nursing students, with the people in the village. Don't be afraid to talk to them because they will welcome you with open arms. And do stuff that you wouldn't normally do, even if if you would never see yourself doing it, just do it and go at 100.
It's actually worth applying. You will learn a lot, and yeah, I encourage you guys to really apply and experience what you experience.
Don't hesitate. Just apply, just do it. It's a good sign that you actually are willing to participate. And I can tell you from this experience, being here for 7 weeks, you'll learn not only how to become a better nurse, but also a better person. And you're gonna, there's a lot of life experience to learn here. So don't be afraid and just apply.
You should apply, even if you think that you won't make it, because you never know. Like, my grades weren't amazing. I had a lot of lack of confidence in stage, but look where I am, and it's helped me a lot. And also, I really want Juliana Marcelino to apply.
If you're thinking about it and you're not sure, just do it, because I kind of wanted to go from the beginning, but I was hesitant because I didn't know if I was good enough to go. And so I almost didn't even apply. It was really people who forced me to apply. And I did all of my referrals literally a week before the due date. I wrote my letter a week before the due date. I thought I was going to give it in on time. I think I did give it late. And then I still got the interview. So if you're not sure and you really don't know if you're good enough, just do it anyway. What have you got to lose?
If you can describe your experience in Malawi in one word.
Oh my god. One word. I don't know.
I really don't know. A lot of words come to mind. I think welcoming, I think hope, because of the fact that people here just keep going. I think stoic, because of how tough people are down here. But I really don't know. I can't think of just one word. Too many words come to mind.
Amazing. The people and the community are so welcoming, very friendly. I grew a lot here, and I made a new family here with all the students that came with me, and with my melody.
Freeing. To me, Malawi has taught me many things, and it's taught me how to feel free in my own skin, feel free in general, not to be worried about what other people think, and just do what you think is right for you and for others. The fact that here family is really important. I'm not saying that it's not important in Canada, just here, like, you feel it. There's a sense of belonging, there's a sense of freedom that I will never forget.
Eye-opening?
What?
On myself, how I act with others, and how I react to stuff in clinical, and how I see myself in new situations. You learn a lot about yourself and how about others too.
Challenging because it actually challenges your, not only your physical, but really your emotional ability. And there's moments that you just feel like crying, you feel angry, you feel frustrated. But at the end, well, I mean,
crazy. Every day you don't know what's going to happen. You don't know how you're going to feel. If you're going to feel good, if you're going to feel horrible, if you're going to feel malaria, if you're going to feel crying, like laughing. It's always different, but it's an adventure.
Chikondi Malawi, Kombiri.
I, Chikondi Malawi, Kombiri. Chikondi Malawi.
Chikondi Malawi.
Chikondi Malawi.
Because we want you all to end on a happy note, as is the tradition each year, the students put together a bit of a dance video, music video. And so here you go. Buckle your seatbelts or stand up and dance along with us.
Joanna, baby, Joanna. Now you be my honey, Joanna. I said, Joanna, baby, Joanna. Now wait till you got it, Joanna. Me, I want to got it, Joanna. Now give it to me, baby, Joanna. For my sexy mama, Joanna. I said, come follow me, friend, oh, 'cause I want to marry you, Joanna. Joanna, I want to marry you, Joanna. Joanna, I want to kiss you, Joanna. I really wanna send you, Joanna, baby, oh. I say when that your potato for me, oh. Get it fit and then baby, oh. Joanna, baby, Joanna.
Jesse and Amos.
I said Joanna, baby, Joanna. Now wait till you got it, Joanna. Me, I want to got it, Joanna. Give it to me, baby, Joanna. For my sexy mama, Joanna. I said come follow me, for you. 'Cause I want to marry you, Joanna. Joanna, I want to marry you, Joanna. I said I want to kiss you, Joanna. I said I want to marry you, baby. I go marry you, Joanna, Joanna. Imakwanina na romaro, kama kwa nina mkabisi. Magina bali jua maga, oh baby bye jua, Joanna baby oh. I say when that's a potato for me oh. Get it fit and then baby oh. Look at that baby oh. Joanna baby Joanna. Now you be my honey Joanna. I said Joanna baby Joanna. I want to carry Joanna. Give it to me baby Joanna. For my sexy mama Joanna. I said come follow me.
our traditional send-off as we leave Makupo village. They follow us all the way out to the road while the girls bawl their eyes out.
So Mel has been our mother for 7 weeks, and she took very good care of us.
Oh, they made me work.
We were the cichlids this year because every day there was something new. I want to say thank you, Mel. It's because of you that we're here and that we did this, and we're always going to remember it. We're always going to remember you on my melody. So thank you. Everyone clap for Mel.
Do you know what a cichlid is? It's those beautiful little colorful aquarium fish that Malawi ships all over the world. So they're called cichlids. And these were my sick kids. But good sports. They never missed a beat. They had malaria. Don't ask why. They were very, very good. Parents don't get angry with them. They took their anti-malarials. They did everything. But anti-malarials are only 95% coverage. So just the same, they got treatment. They were better the next day. I don't think anybody missed a clinical day. Maybe one. But anyway, they were tough, tough, tough. Impavu. Thank you so much, everyone, for coming. See you next year.